What are the risks in hair transplant surgery?
Hair transplantation is often the first procedure people consider when they try to treat their genetic pattern hair loss. Hair transplant is oftentimes not perceived as actual surgery when it is very much a surgical procedure. Any invasive procedure carries risk, which can be managed. In medical care, risk is reduced through proper patient selection combined with practitioners having a high level of expertise and experience. Training in cosmetic surgery, such as facelifts, are through fellowships such as those approved by the American Board of Cosmetic Surgery. In contrast, hair transplant surgery can be offered by practitioners who have no formal surgical training through residency or fellowship. Typically, a hair transplant is performed predominantly by technicians, with or without a surgeon actually having their hands in the transplant operation. This means that one doctor can have multiple procedures occurring simultaneously performed by technicians. As such, there is tremendous competition in this highly profitable business. Any casual search online reveals quickly how aggressively hair transplant surgery is marketed with little emphasis on appropriate patient selection and transparency about who will actually be performing the surgery. All this being said, hair transplant surgery can still be beneficial for the right candidate. I'll discuss my perspective on when a hair transplant is appropriate in the context of the risks associated and alternative options available. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I performed hair transplant surgery for many years in my practice. Back in 2011, in an effort to help improve hair transplant results, I used a wound healing material called extracellular matrix by the company ACell. A year later, the transplanted hair grew very well, and surprisingly, areas where hair was not transplanted had significant regrowth as well as thickening of thinning hair. I developed this discovery further into a standalone, non-surgical treatment for male and female pattern hair loss called TrichoStem Hair Regeneration. Since 2011, we have used the TrichoStem Hair Regeneration System to help hundreds of people every year from around the world with genetic pattern hair loss and other hair loss conditions. For many of our patients, we routinely perform only 1 to 2 treatment sessions with results lasting for 3 to 5 years or even longer, which makes TrichoStem hair regeneration well recognized as the benchmark of PRP and ACell treatments currently offered. This has made a tremendous impact in helping people who previously would have been resigned to having a hair transplant because no other highly effective option was available. Many people, unfortunately, in their haste to have hair transplant surgery, experience issues without having had an understanding of the risks involved and learning about them when it's too late. For example, a risk with hair transplant surgery has to do with timing. It's very common for men in their 20s to panic about experiencing hair loss and undergo a hair transplant operation. Although this may provide some short-term relief of anxiety, the long-term outcome is oftentimes a cause for regret. If you have enough hair loss in your 20s to justify a transplant, very often your rate of hair loss is likely to exceed your ability to keep up by undergoing more surgery as you continuously lose hair. Regardless of technique, there is not enough donor area to provide the natural density you once had for the much larger area of hair loss. For many people who had several hair transplant surgeries since their 20s, years later, only sparse transplanted hairs remain as native hairs thin and disappear, resulting in looking like you have little hair at all and you're left with an unnatural appearance. Another issue that is not routinely fully disclosed is the collateral loss of your existing hair during transplant surgery. Routinely, hair grafts are transplanted close to native hair follicles. Unfortunately, the sharp instruments used to make the incisions for transplanting hair can very easily damage your existing hair follicles, resulting in even more hair loss. This is one of the main reasons that women with hair loss are not usually good candidates for hair transplant surgery, since female pattern hair loss is characterized by diffuse thinning without smooth bald areas. People who have had hair transplants are frequently easy to spot due to the conspicuous spacing characteristic of transplanted hair. Although it may seem logical to transplant hairs more densely to compensate for this issue, this approach can result in the loss of a significant number of irreplaceable hair grafts. This is because the skin integrity and blood supply for graft healing and growth limit the density of hair grafts to about 20 grafts per square centimeter of the scalp. Natural hair density ranges from 50 to 100 hairs per square centimeter. When safe hair transplant density is exceeded, compromised skin integrity and limited blood supply can result in as much as 90% of grafts not surviving after surgery. FUE, or follicular unit extraction, is currently the most popular technique for hair transplant surgery. The technique entails the use of a very narrow circular blade, also referred to as a punch, to harvest individual hairs with their roots for transplantation. This technique avoids the strip scar of FUT surgery. Unfortunately, this technique results in a phenomenon called transection. Transection occurs when the punch cuts through the skin and 30% of the time cuts the hair without the root. Without a root, the hair will not grow. This means that there's a minimum of 30% loss of hair grafts. Additionally, since FUE grafts are harvested in areas close to where hair is thinning, many of these grafts, if they survive, are subject to thinning faster than hairs harvested from the true permanent zone of hairs resistant to hair loss. As mentioned earlier, I performed hair transplant surgery for many years. I developed TrichoStem Hair Regeneration while trying to improve hair graft survival after transplantation. Practically speaking, hair transplant is the most effective for men with frontal balding, where little or no hair is at risk for collateral loss. In my experience, most men who come for hair transplant consultation have thinning hair, not smooth bald scalp. This means that a procedure that thickens thinning hair can potentially result in better coverage than a hair transplant by virtue of the natural density of your existing hair. Since 2011, we've observed this phenomena with TrichoStem hair regeneration treatment. Speaking as an experienced hair transplant surgeon, I can state without reservation that our outcomes often exceed the results of not one, but even two transplant surgeries. In androgenetic alopecia, or male and female pattern hair loss, a higher percentage of hairs are in a prolonged resting phase. As opposed to hair transplant surgery, TrichoStem hair regeneration treatment results in reactivation of hairs which are in a prolonged resting phase. Therefore, coverage is improved due to both thickening of thinning hairs and increasing the actual number of hairs that are actively growing. A typical treatment plan involves 2 sessions of scalp injections that are performed 18 to 24 months apart. Benefits are generally sustained for 3 to 5 years or longer. Additional medical therapy may be recommended depending on your category of hair loss. If you're experiencing hair loss, hair transplant can still be an option, but not necessarily the first one. I often tell my patients that every hair that is regrown or thickened is a hair that doesn't have to be transplanted. After maximal coverage is achieved non-surgically, we then assess whether hair transplant would be useful for additional frontal scalp coverage. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.